Good day. I am John James, an EMT attached to the Leaside Fire Department, and today I am here to conduct a patient assessment on a trauma adult patient. So call came in through dispatch at about 1500 hours of a male that was climbing a tree and fell and has sustained some form of injury and has been on the ground since and is in need of medical assistance. So, BSI, when we have a partner, the scene is safe, number of patient 1. ALS is on standby, and the mechanism of injury is fall, and I am considering C-spine at this time. So forming a general impression of a patient, I see a 1 male patient of African descent, appears to be in his 40s and is in somewhat of discomfort, lying supine, and appears to be responsive. So I'll approach my patient now in the line of sight to ascertain an LOC. Sir, I am EMT James. If you can hear me, don't try and move your head. If you feel somebody is touching you, it's my partner and he's here to assist you, alright? So I'll ask my partner to manually take C-spine. Alright, so now I can go further into my LOC. So sir, can you tell me your name please?
No, Lawrence.
Alright. So what happened to you today, Mr. Lawrence?
So 1 year, so
Fell from how high you fell?
10 feet.
10 feet? Alright, you know what date is today?
14th. 14th of June.
Okay, alright. Then what's the date of birth?
1975.
Alright, so this patient is fully oriented. Patient was talking to me and has a patent earwig. So I see no life threats, so I'm going into my ABCs right now. So moving on to breathing, I'm going to auscultate. Just take a deep breath for me, sir. You don't know. Again. 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 Alright. Want to check the breathing rate from a patient. Patient has a breathing rate of 18 breaths per minute, and I see adequate bilateral rise and fall of the chest, and as well as the breathing is as a normal rhythm. Alright, so moving on to circulation, checking the pulse bilaterally. Patient has a pulse of 90 beats per minute, and it's regular rhythm and strong. Also checking the skin condition, warm and dry, cap refill, less than 3 seconds, mucous membrane, pink. Alright, so making a transport decision now. It's a load and go patient, so I now place my patient on a backboard and move into the ambulance. Now at this time, I'm going to apply a C-collar to my patient. Before I do so, I'm going to check for trachea deviation, as well as looking for JVD, and there is none present. Also, palpate the spine, and the spine is intact. So now I'll apply my C-collar. And I'll now log roll my patient down to the backboard. So my partner there will give the count.
1, 2, 1, 2, 3, over.
Alright, so checking the back, palpating the spine, checking for decap ETLS. There is none present. Going to auscultate the back. Alright, and the back seems to be fine. to give the count.
1 and 3. 1, 2, 3. Go.
Secure the edge using net blocks. Alright, so now I then proceed to lift the patient and bring him to the back of the unit. So now in the back of the unit, while they're out, I'm now going to take a sample history. So sir, can you give me allergic to anything? No? Yeah, any medication? What about your past medical history? No? Alright, what was the last thing you ate? Okay, and you said leading up to this you were in a therapy and you job promoter in therapy. Alright, did you lose consciousness at any given time? No? Okay, alright, good. So you're feeling any pain anywhere? In the lower back? Alright. How bad is it? On a scale of 0 being no pain, 10 being the worst pain you ever felt. How much do you rate the pain? 7? Alright. So the pain radiate, does it move or is it stay in place? One place? Alright. So what about the quality? What it feel like? What pain feel like? A sticking pain? Alright. And you say the pain doesn't move or transfer anywhere. So nothing you do make it worse or better. Okay, alright. So now at this time, I'll take a set of baseline vitals of a patient. I'm going to do a quick GMR. So I'll sanitize the finger as well as prick the finger. This patient does a GMR of 5.5. Getting a pulse ox reading. Temperature 97.2. Patient does a pulse ox reading of 97. Patient has a BP reading of 130/80. I will know after obtaining set of baseline vitals, I will know going to doing a detailed echo examination. So I'm now going to palpate the scalp, checking the ears, checking the nostrils, when you check the pupil. Just open your eyes for me, sir. Look straight at me. Pupils are pearl. But I've already checked the neck area. So now, sir, I want you to take a deep breath from me in and out. Again. Alright, no abnormalities. Palpating the abdomen. Checking all 4 quadrants. Did you feel any tenderness or any form of pain? No? Alright, checking the groin area. Checking the pelvis for stability, pressing in and down on the pelvis. Any pain with that? Alright. Checking the lower extremities. Checking PMS, dorsalis pelvis pulse. Can you wiggle the toes for me? Alright. Push down on my foot, on my hands. Pull back on my hands. Alright. Which foot am I touching? Which foot am I touching? Alright. Checking the upper extremity now. Any pain anywhere, sir? No? Any pain with that? Alright. Which arm am I touching? Which arm? Alright. Can you grip my fingers for me? Alright. Checking radial pulse. Pulse is intact. Alright, so this patient, I would continue to reassess every 5 minutes while I go to the hospital. And then in my reassessment, I will check back again from LOC, coming right back down to see if my interventions have worked or if my patient has declined. So now, in reaching at the hospital, in handing over, so good day the medical staff. So we have a 1 male patient in his 40s of African descent who earlier today was in his neighbor's yard picking starapple when he fell from a height of about 10 feet and hit his lower back. In assessing the patient, we found no immediate life threats. However, we took the necessary C-spine precautions to ensure that further harm or injury was not done to the patient. The patient complained of a pain on a severity scale of 7 with a sticking pain. PMS is intact and the patient has good bilateral rise and fall in chest and is in need of no oxygen. However, I will continue to do further observations and to ensure that this patient gets the best care in the shortest possible time. Here is my presentation. Thank you.